next thing is, so both are because of beta 1. So you see, easy to remember, beta 1 action. When you think of beta 1, you get heart, you get kidney. You remember them and your job will be done. So that is one thing. Next thing is that epinephrine constricts arterioles in the skin, mucous membrane and viscera, and it dilates vessels going to liver and skeletal muscle. So this is because of beta 2 action. Okay. Now this is easier also. You tell me, all of you, if there is epinephrine, that means which system is active? Rest and digest or flight, fright, fight? Which system do you think?
Sir, it
Always fight, fight, flight.
Yes, fight, fright, flight.
Fight, fight, fight.
So, if you are having a fight, fright, flight issue with anyone, someone, okay, so what do you think? Your skin should need more, skin should need more blood, or your skeletal muscle should need more blood?
muscles, sir, skeletal muscles.
Markets.
So, you see, it is logical, na? That if you are having epinephrine, then it is actually channelizing the blood from your skeletal muscle and is sending it to skeletal muscle.
Yes, sir.
The arterioles of your skin, they are getting squeezed, constricted. So blood is not going to your skin, it is directly going to your skeletal muscle. And also another thing is that it is going to the liver. Why it is going to liver? Who can guess why it is going to liver?
স্যার ওই রাস মেকানিজমসের জন্য মানে যাতে কিডনিতে পৌঁছা মানে
No, more it will go to liver. It can bring out the glycogen from liver. Codi's cycle, biochemistry. Do you remember?
হ্যাঁ স্যার
So more blood will go to liver, more it will get the nutrition, energy and everything and get it back to the skeletal muscle. So skeletal muscle will need it, na?
হ্যাঁ স্যার
Yes, sir.
Yes. So I hope now you can correlate and remember these effects, points.
Yes, sir.
Everyone?
হ্যাঁ স্যার
Yes, sir.
Okay. So this is about the cardiovascular. Now moving with the next point. So in the next point we will talk about the respiratory. So in respiratory, which receptor was present? Who remember? Respiratory part. Was it beta 3?
Beta 2 zero.
Yes, beta 2 chilo, because beta 1 was in 2 places. Beta 3 was also in 2 places only. Sorry, beta 3 was in 2 places only. So what is left is beta 2. That means in your respiratory system it is mainly beta 2 present. So you can remember that epinephrine causes powerful bronchodilation. So in case of emergency, if there is any bronchospasm, any bronchospasmic condition, say anaphylactic shock. Anaphylactic shock also you have studied, I guess, this year maybe or last year. So in these cases, if you see that there is bronchoconstriction going on, you can immediately stop that bronchoconstriction by giving this drug. So epinephrine is very, it is an emergency. Every doctor should have it in the medical kit. Even I also have one ampule, though I never need to use it. So every year I throw it off. I get fresh ampule. That ampule also remains like that. And as of now I haven't used it, and I am very happy that I never needed to use it. I hope you understand that. Using it means you have faced danger. And never used means you have been safe all throughout.
Yes, sir.
Yes. So this is that funda of epinephrine. Okay. So everybody got it about this respiratory part?
Yes, sir.
Yes, sir.
Acha. So all right. Next thing that we have, that is this lipolysis. So in lipolysis, how do they do it? How can you break down? So adipose tissue, it contains again beta receptor. And again, beta receptor will act via which pathway? Who remembers?
Sir, GS.
Yes. So once again, that cyclic AMP will get activated and blah blah blah. All those things will happen. Okay. So cyclic AMP pathway, and then there will be secretion of one beautiful enzyme. It is called as HSL, hormone sensitive lipase. Have you heard of this before? Hormone sensitive lipase. This is hormone sensitive enzyme. Never heard?
Nah, sir.
Acha. Okay, so at least you tell me this much, that if you are causing hydrolysis of triglyceride, okay, if you are causing hydrolysis of triglyceride, then what is the product that you will be getting?
Sir, fatty acid or glycerol?
Jack, very good. Yes, you know it. So it is fatty acid or glycerol. Okay, so there is nothing more special discussion in this. So this is how the lipolysis is done. Moving on, next we talk about another thing that is called as biotransformation. As of now, here there are things that you have to remember. That is two pathway. One is MAO and another one is COMT, and which has S-adenosine methionine as a cofactor. Last year, I don't know, in biochemistry, have you studied that SAM cycle? During our days, it was there in the syllabus. We had to read the SAM cycle. So have you read SAM cycle? It is SAM is adenosine methionine. So that's SAM. So we had it. You ever studied in biochem?
Nah, sir.
No. Okay, no problem. So this you have to remember basically. And then the final metabolites found in the urine are metanephrine and vanillyl mandelic acid. So these are the two names that you should remember. One is metanephrine and the other one is vanillyl mandelic acid. And since they can pass through the urine, so urine will also contain this norepinephrine. So norepinephrine is basically the you can say it's a product of norepinephrine metabolism. Okay.
Yes, sir.
All right. So now let us talk about that. We are going to give this drug. We are going to prescribe this drug. So kinetics of it is very important. What should be the pharmacokinetics? So what do you think? If you talk about epinephrine, the original one, so its action will be rapid or its action should be slow?
Sir, rapid.
Okay, why did you say so? Because it's written on the screen?
মনে হয়
মনে হলো it will be rapid only. That's what we learned, na? That if it is say epinephrine, then it will have a very high affinity for the beta 2 and for the beta receptors, highest affinity epinephrine followed by norepinephrine. We discussed, na? So rapid action, but will the action will be short lived or long lived?
স্যার মেটাবলাইজড হয়ে যাচ্ছে মাও আর সিওএমটি, তাহলে শর্ট লিভ হবে।
Exactly. So because of MAO and COMT, they're getting metabolized and hence it is going to be short-lived. See, you know the structures, you know the reactions. These things become so very easy for you. This is what I was telling. So, how do we administer? Because the first point of this pharmacokinetics was the route of administration. So what should be the preferred route for administration? Of course, injection.
হ্যাঁ স্যার।
Okay, so mainly we can give intramuscular, but if you are giving this epinephrine in case of emergency, say somebody is having asthmatic attack, gala is choking, So at that time you have to give IV because you want that highest speed of action, rapidest of rapid action you want. Okay, so this is there that you have to it uses up very fast. It is short lived. Acha, can we give it subcutaneously?
হ্যাঁ স্যার পারবো দিতে, কারণ ওখানে তো কোনো মাও বা সিওএমটি তো নেই, তাহলে তো ব্রেকডাউন হবে না।
Once again your voice got broken.
আচ্ছা স্যার, বলছি মাও আর সিওএমটি তো সাবকিউটেনাস রিজিয়নসে নেই, তাহলে তো মানে ব্রেকডাউন হবে না, তাহলে তো এফেক্টিভ হওয়ার কথা।
মাও COMT সাবকিউটেনিয়াস লেয়ারে নেই,
হ্যাঁ
তার মানে
মানে-
we can give it subcutaneously.
হ্যাঁ স্যার।
Yes, so we can give it subcutaneously, we can give it by the endotracheal intubation, okay, and we can also give it by inhalation as well. But oral is not a good idea. Oral one is not at all a good idea, okay?
হ্যাঁ স্যার।
Because same reason, intestinal enzymes that MAO and COMT, like you said, okay?
হ্যাঁ স্যার।
And if you have any metabolites, the metabolites will be found in the urine.
হ্যাঁ স্যার।
Okay. So having said this, now we talk about the therapeutic uses. So the first therapeutic use that we will be talking about, that is lungs related only. So bronchospasm. Spasm in the bronchi. I hope everybody understands the meaning of the word bronchospasm.
হ্যাঁ স্যার।
So if somebody asks you what is the drug of choice, what would you say? Drug of choice. আরে just now we discussed না?
স্যার বিটা 2 রিসেপ্টরকে আটকাতে হবে, তাহলে তাহলে তো এপিনেফ্রিন বা নন এপিনেফ্রিন।
হ্যাঁ, so actually it is the epinephrine which is the drug of choice, okay, because it is available with us in our emergency kit. So epinephrine is the primary drug used in emergency treatment of any condition of the respiratory tract where bronchospasm is there. Okay, have you studied something called as shrilled voice, shrilled sound? It's a type of a breath sound which is present. In technical language, in medical language, we call it as wheezing. Have you heard of it?
মানে ওই ভয়েসটা কেটে যাওয়ার মতো কি?
No, it produces a very shrilled, like surreal, as if somebody is trying to sing song, like it is that kind of a sound.
না স্যার, শুনিনি।
Acha, when some people they feel that okay, I'm choking to death, so okay, to gasp the last breath also they try to breathe in.
হ্যাঁ স্যার, ওই এপিগ্লটিসটা মাঝে মধ্যে বন্ধ হয়ে গেলে ওরকম আওয়াজ হয়, মানে এপিগ্লটিসের মাঝে মধ্যে একটা
না,
প্রবলেম থাকলে
usually এই যে আওয়াজটার কথা বলছি, this is only heard if air is passing through a very very narrow passage. Narrow passage দিয়ে পাস না করলে সাউন্ডটা তো ক্রিয়েটই হবে না।
হ্যাঁ স্যার, তখন এপিগ্লটিসটা তো বন্ধ থাকছে, তাহলে পাসই হবে কি করে?
না না, এপিগ্লটিস ইজ ওপেন। এপিগ্লটিস বন্ধ থাকবে কেন? এপিগ্লটিস বন্ধ থাকলে তো এয়ার ওয়ন্ট এন্টার না। এপিগ্লটিস ইজ খোলা। Gaseous exchange is, air is also going in, but there is difficulty because the airway passage has got narrowed down. There is narrowing of airway passage.
স্যার আমি এখন বলি, আমার বাবার এরকম হয় আর কি, তো হি ইজ ভেরি অ্যালার্জিক টু সার্টেন ফুডস, তো ওই ফুডগুলো খেলেই বাবার মানে চোখ হয়ে যায়, তখন হি মেক্স দ্যাট কাইন্ড অফ সাউন্ড লাইক দ্যাট, লাইক দ্যাট কাইন্ড অফ।
হ্যাঁ, so that is the thing না, so that is not because of epiglottis.
ওকে স্যার,
That is because
এপিগ্লটিসের জন্য।
no, epiglottis, if it is closed then the person will die. It is not because of epiglottis, it is that there is bronchospasm. There is like very less air coming through it and the patient is actually struggling.
তাহলে কি স্যার এপিনেফ্রিন বাড়িতে রাখবো?
না, মানে হ্যাঁ, you can actually, but it is called as EpiPen, but in India EpiPen is not available. আর বাড়িতে তুই রাখতে পারবি না, তার জন্য তোকে কিনতে হবে, so you won't get it. Another thing is that also you don't know the dosage, how much to give in what condition. So right now don't do that. Once, like, wait for a couple of more years, once you start general medicine. After that you can do. After
Okay.
that you can like actually get training and then actually see how we deal with it in the clinic. Okay.
Yes, sir.
All right. So yes, remember this. So in case of treatment of acute asthma, in case of anaphylactic shock, epinephrine is again a drug of choice. So epinephrine is like a life-saving drug. Okay, we use it for so many purposes. Now within a few minutes after subcutaneous administration, you can get result. It's very potent bronchodilator. And then after the patient recovers, if you really feel like, then after a few hours again the dose can be repeated. Now beta 2 agonist is also there. Do you know what is beta 2 agonist? It is albuterol. If you have those asthmatic puff, pus, the people who have asthma, inhaler.
Yes, sir.
Yes, so some of those inhalers also have this albuterol. Okay, so albuterol is a selective beta 2 agonist. So beta 2 is present where? In the lungs. So this is very good. Okay, albuterol. So but it is not for acute case. For chronic treatment of asthma. Some person has got asthmatic tendency since 1 year, 1.5 year. Okay, but why? Selective beta 2 is fine. But anything else or anything other special thing about albuterol? Yes, because it has got a longer duration of action and minimal cardiac stimulatory effect. See how much research a patient will do, then only the patient will say, okay, give me albuterol, because albuterol will have a longer duration of action and it has got minimal cardiac stimulatory effect. And if you are a doctor, then you should also consider this thing, okay, about albuterol.
Yes, sir.
Yeah. Next thing is key anaphylactic shock. So for anaphylactic shock, it is the epinephrine which is again the drug of choice. And I am telling it again and again, anaphylactic shock is basically a type of allergy which is called as type 1 hypersensitivity. So the reaction is due to the allergens. Alright. So that is anaphylactic shock. Over there also epinephrine can be given. If a person has undergone cardiac arrest, then also, intracardiac injection is also there. In movies you must have seen. Like they take a syringe and then they put it on the chest. And nobody knows where the needle is going. But you should know that's of course a movie. But are you understanding what I'm saying?
হ্যাঁ স্যার বুঝেছি
হ্যাঁ.
স্যার তাহলে বাবার যেটা হয় দ্যাট ইজ কি টাইপ 1 হাইপার সেনসিটিভিটি
Yes, that is a type 1 hypersensitivity, of course.
ওকে স্যার
All right. Then another thing is that is in our dental setup we use it a lot, that is local anesthesia. So in our local anesthetics, if you go to your college and if you check out the local anesthesia, that vial, it will be written that it contains 1:1 lakh part of epinephrine. 1:100,000. 1:1 lakh. Why we do it? Why it is mixed with epinephrine? Because when you mix it with epinephrine, then actually what happens is it is going to act as a vasoconstrictor. We learned, the blood vessels, arterioles of the skin and mucous membrane will be squeezed.
হ্যাঁ স্যার
So if you are squeezing the blood vessels, is there anyone to drain away that epinephrine or the local anesthesia?
না স্যার
No.
তাহলে ট্রেন করছে না
So it will remain over there for longer period. Like suppose for example, for Obirup I am going for extraction of lower premolar. Now I give some anesthesia, local anesthesia, normal, only local anesthesia. So what will happen? After a few minutes, that local anesthesia will gradually diffuse into the bloodstream. And when it will gradually diffuse into the bloodstream, so then what will happen? Then in that particular area, the anesthetic effect will be gone. But imagine if I am actually giving some epinephrine over there, so epinephrine will be squeezing those local arterioles. The anesthetic won't be able to run away. So your premolar area or molar, whatever I am extracting, that area will remain numb for a longer period of time.
স্যার তাহলে ওটাকে আইভি দেবো না
No, subcutaneous, local subcutaneous. And actually we don't need to give also. Basically it is mixed with the local anesthetics. So wherever you are depositing your anesthesia, same place your epinephrine is also going. Okay?
ওকে স্যার
All right. And I think this is, there are some more therapeutic effects, but I want that we go a little slow for this. I will take one more class to finish up with this agonist, okay? Because here I need to explain a little bit more. I'm not intending to continue today much. Okay, next class can we continue?
Yes, sir.
Yes, sir.
Okay, because it's like almost going to be 10:30 only. It's 10:20 almost. So let's stop over here today. See you in the next